give him a warm welcome, Dr. David Cavan.
Thanks so much. Thanks. So, thank you very much, Sam, for the kind introduction and for inviting me to come to this very, very important meeting. I'm going to be talking a little bit about my journey over the past nearly 10 years now towards understanding that low carb actually does make sense. I'm going to spend a bit of time, and apologies if this duplicates some of the presentations yesterday, and I can speed through if necessary. But I get asked so often, what do I mean by reversing type 2 diabetes, and shouldn't we call it remission and all the rest of it? So I just like to share what I think and how I use the term. And then I've spent much of the last year in Bermuda, poor me. And so I'd like to just share some of the challenges of trying to do this in a small island like that. So what about my own journey? For many years, I was, if you like, just a jobbing doctor. I worked in the Bournemouth Diabetes and Endocrine Centre as a consultant in diabetes. And being a specialist centre, the focus was very much on type 1 diabetes. And type 2 diabetes was sort of boring, and we left that to GPs. And because we did. But what I realized very early on in my career is that actually, if someone with any type of diabetes doesn't actually understand fully how they can take control of it, then we're all wasting our time. And so I became a little bit unusual as a doctor, and I became really interested in self-management education and developing education programs for people with diabetes. And that stayed with me throughout my career. Actually, I was reflecting just having heard Asim's interaction with his medical director. I never reached the level of medical director. I was a clinical director in medicine for 6 years in the early years of this century. And looking back, one of my targets that I was actually held accountable for from amongst the cardiologists is how many angiograms are they doing? That was it. Didn't matter whether they were worthwhile or not, or whether they were required, but just the number. And I remember thinking, because I was a bit of a rebel back then, why on earth is that a target? And I have no idea. But, you know, cardiologists like doing them, so they were very happy. But so I came out of that, and then about 10 years ago, I got really excited about type 2 diabetes because there were lots of new exciting drugs going to come out. You know, Bariatric, the GLP-1s, the gliptins, you know, and they were going to transform it. They were going to sort it like the other drugs hadn't. So I was really excited. And so I started seeing lots of people with type 2 diabetes. I thought, I want to be part of this. And I prescribed lots of their medications because we saw lots of reps who said they're really good. And that's what I did. But as you can see, within a very short time, I became quite disillusioned because, yeah, they'd take the tablets or do the injections and then things would get better. But a year later, they were very often back at square one. So I became really quite disillusioned. So I started asking people, well, confession time, first time in my career, asking people with type 2 diabetes, what actually do you eat? What's your lifestyle like? And I was quite shocked with the responses, so I began to send some of them to dietitians, but then they'd come back and say, the dietitian said I should eat more carbohydrate. And I said, that doesn't sound right. So I just became a dietitian. I mean, well, I couldn't become a dietitian, but I started advising on food. And my consultations now, ever since, are predominantly about food. And I started advising low carbohydrate diets. And as you will all know, because you understand this, I was just absolutely gobsmacked with the results that I was getting. I felt very alone. I wasn't aware of anyone else in the world who was doing this at the time. So I sort of had to do it secretly. But I got away with it. One of my first patients was a lady who was on 100 units of insulin a day. Very overweight. And the question was, should she go on one of these new fancy treatments? But she had a contraindication. So I said, well, we could try that, but actually, we could just try stopping you eating the stuff that's putting your glucose up in the first place. And she did, and she came off insulin. Been on insulin for over 10 years. This is now normal. But then it was revolutionary because we thought, you know, once you're on insulin, you're insulin for life. And then somewhere along the line, I found myself becoming an author. I was asked to write a book about self-management of type 2 diabetes. I actually wanted to write one about type 1 diabetes, but they said there's not enough market, not enough people with type 1 diabetes. See if you can do something for type 2. So I said, okay. And it was quite exciting because I thought, well, okay, this gives me a great opportunity because I can put in here all the stuff about low carb and how it really works. But what was really exciting and what for me was just like absolutely, a game changer was the evidence that actually type 2 diabetes could be reversed. And I remember thinking, I want every single person with type 2 diabetes to know that because it changes the whole experience of having it from one of being despondent, despairing, no hope, it's just going to get worse. If you're lucky, we can keep you off insulin for a bit longer if we do the right things, to one where actually you can take control and you can do something. So rather provocatively, the title is As You See It. And after it was written, I started getting contacted by people who say, well, it works, I've reversed my diabetes. Now, actually, having heard Trudy and all the evidence and everything else, I'm just a jobbing doctor. I didn't do research trials or anything on it. I just put it in because I thought it sounded like a good idea and hoped I could get away with it. But it worked. And one of the great things is some quite influential people who've read the book reverse their type 2 diabetes, and I'm now working them in different ways to spread the message further. Some of you may have heard Dan Parker, who was before the Health Select Committee. He used to market Coca-Cola until he got diabetes, and he's now turned his life around, both medically, but also he's been trying to use his marketing skills to get people eating the right things. And there have been documentary makers, TV producers, and others who are wanting to help in different ways to get this message across. A couple of years later, this book came out. And those of you who write diet books will know, I had no idea because I'm just a doctor. They said, well, if you produce a book with diet in the title, it'll sell loads. And that was in the contract. They'd only do the first one if we did the second one. So we did. And yes, it sold far more because it had recipes in it, some of which weren't really very low carb, but I didn't write them. So, but then moving on, and self-publicity doesn't come very naturally to me, but I've been told to tell you, I've finally been allowed to write the book I always wanted to write, Take Control of Type 2 Diabetes. It comes out in a couple of weeks' time, and if you go to the desk out there, you can pick up a flyer which will tell you how you can order it from Diabetes Co UK bookshop. But then, about the same 5 years ago nearly now, I got an opportunity to go and do something completely different, midlife crisis, all that, and I found myself working as Director of Policy in Brussels for the International Diabetes Federation. I could talk an awful lot about that. It was very, very interesting. Actually, as things happen, my first book came out while I was there, and I was told well, one, there were moves there to try and stop it being published, but they were told, no, you can't do that, but it can't talk about reversing diabetes. And so I had a bit of a clamp put on what I was allowed to say and in what way. But we did manage to get 2 World Diabetes Days, which is a global event focusing on lifestyle and prevention for the first time ever. And there was some movement in the right direction in their nutritional guidelines, although they've since reversed a bit. But anyway, so my wife and I and our 2 dogs and a cat, we moved to Brussels and we lived there for 3 years. But then we decided Brussels is a lovely place to go and visit, and I know the people here who live in Brussels, but it wasn't for us. One language is enough, and they speak 2, often on the same road. I mean, it's just incredible. So we came back. And but about the day after I decided that we were going to come back, I got a call saying, would you come and work in Bermuda? So I spent much of last year working in Bermuda, again with my wife and 1 dog, because the other had died by then. And most recently, I work in Brighton as a part-time NHS consultant, where there's a bit of a low-carb revolution going on now. Just about every patient we see gets a low-carb leaflet. You see, I only work in places that begin with B. So What is type 2 diabetes? You'll know this, but I just want to go through it to make absolutely sure and emphasize the fact it's an insulin problem. It's not a glucose problem. It's a problem where insulin doesn't work effectively. That then is associated with high levels of glucose in the blood. And because you have this insulin resistance and high glucose, you get high insulin levels in the blood. The glucose comes from breakdown of starch and sugars, obviously, and it enters the blood from the gut, but also from liver stores. And insulin, as you know, is produced in the pancreas, and its job is to enable glucose to get into the cells where it's used as energy. Then any excess is stored in the liver as glycogen and then as fat. And this is where it gets really, really important. Now, one of my roles at the IDF was to coordinate publication of the Diabetes Atlas. This comes out every 2 years, and it estimates the prevalence, estimated prevalence of diabetes globally. And look at the black lines in the middle. They show that with each edition, the numbers just keep going up and up. And since the year 2000, from about 150 million to 425 million in the most recent edition. And the bars on the right are projections for 25 years hence. Look back towards the left to 1964. There was an estimate, it could only have been that there might have been about 30 million globally. So you can see this is a massive increase, and it's been very steep in the last 20 years, and we all know why that is. And the vast majority of it is type 2 diabetes. Now, 20 years ago, or just after, when I first started working in Bournemouth, we used to see people newly diagnosed with type 2 diabetes. We had an open access education program, and we used to say, well, we don't really know why you've got diabetes. It sort of happens. It's nothing to do with what you've eaten. But bizarrely, we'd then say if you change what you eat, things might get better. We hadn't yet had this big explosion of diabetes and big explosion of obesity. Since then, there's so much evidence now that shows it is our modern day lifestyles that have promoted and contributed to this. And that includes physical inactivity. Prolonged sitting down, even driving to work. Someone mentioned yesterday the study from the 50s comparing bus conductors with bus drivers, a similar one with telephone operators and postmen. People who sit down all day get iller than people who are on their feet. And a more recent study from London showing that if you drive to work, you're less healthy than if you walk or cycle. That's obvious, but actually taking the bus is a good option as well, because you've got to walk at each end of the journey. And then the unhealthy diet. I won't go into this in detail because obviously we've covered this a lot, but the more of these things that you have, you'll push yourself up that curve from a normal HbA1c through to what is now called pre-diabetes and then into diabetes. And we used to think it was a one-way street, that once you're on it, it's just going to get worse and worse. So pretty hopeless. And I mentioned to someone yesterday, when if someone with pre-diabetes, impaired glucose tolerance it used to be called, came to our education class by mistake, because they didn't actually have diabetes, we said, well, you might as well stay, but otherwise go away and come back when you've got diabetes and we can maybe do something for you. How awful is that? How awful is that? Because this is what we thought happened, but we now know, and we learnt from the prevention studies, flawed as they were because they were based on a low-fat diet, but they showed that if you can intervene in the middle there, when someone has pre-diabetes, you can actually stop them getting type 2 diabetes. But what's often overlooked is that in those studies, up to 30% of people actually reversed and reverted back into normal glucose tolerance. Not as good as David Unwin's 98% or whatever it was that he recently won an award for at Diabetes UK. But, changing lifestyle makes a big difference. But then what, as I said, for me was just absolutely, the turning point in the whole understanding is that actually it's also reversible. And even if you're up there, you've got diabetes, you've got really, you're on 100 units of insulin, if you change your lifestyle, and I've just summarized what constitutes healthy diet from some of the studies. I don't think I mentioned any more detail of that because Trudy's in the room and I don't want to be critiqued. But they're sort of healthier things. You can reverse it. Now, of course, the first evidence for reversal came from people with type 2 diabetes who had bariatric surgery. They were overweight or obese. They had surgery to remove half their stomach. And by and large, they lost weight and they lost their diabetes. And this still remains, and you can argue whether it's appropriate or not, but it still remains a very, very effective treatment for type 2 diabetes in the morbidly obese. Something like 80%, if they have a procedure like this, go into remission. They no longer have diabetes. And it was this observation that led to the Counterpoint study that was published in 2011 by Roy Taylor. And this was designed as an experiment. It wasn't designed as a lifestyle intervention. It was an experiment. Can we take some very overweight people, a small number, who have type 2 diabetes, get them to lose a lot of weight quickly by a very low-calorie diet, and see what happens? And so they measured lots of clever things like fat in the liver and the pancreas and insulin secretion and insulin resistance. And of course, what happened was if they lost 15 kilograms in weight, which they did on average, their diabetes went into remission. Normal glucose tolerance. And this was associated with the loss of fat from the liver and the loss of fat from the pancreas, which, as that happened, it helped reverse the underlying processes associated with type 2 diabetes. So what this was telling us, and I hope this works. I'm not very good at fancy PowerPoints, but bear with me. What this is telling us is that if you're in a situation where you're bombarding your system with too much glucose, whether it's from sugars or from starches, you have high insulin levels. Those high insulin levels, because the glucose stores are then filled, end up promoting fat accumulation in the liver and in the pancreas. The liver fat causes insulin resistance, which causes even a higher blood glucose. More high insulin levels have to be produced, and so on and so forth, until the pancreas eventually gets full of fat, and you end up with type 2 diabetes. So that's the understanding of what type 2 diabetes is. What's going to make that worse? Our standard treatment up until recently for type 2 diabetes. So those of you who remember from the UK PDS, those charts that just showed for the years following diagnosis, HbA1c just gets higher and higher, which led into this inevitably chronic progressive disease. There's nothing much you can do about it. It's being fed by exactly the thing that's causing the problem in the first place. And then what do we do when the glucose levels get too high? We add in even more insulin. So, I just struggled, and you can see how when I was told by the great and the good that I shouldn't really talk about reversal as a director of policy, well, that's what the problem is, and we know it can be reversed, and we've got to stop people. Why don't we just stop promoting it in the first place and help people reverse it? The healthier option is, of course, the opposite. It's to reduce carbohydrates in the diet, which just undoes all of those bad things and promotes reversal of the condition. That pathway there, that's what I call the diabetes disease process. It's not a very fancy technical medical term, but it's something that people understand. And when I talk about reversal, I say if you can change your lifestyle, we can then help you reverse that diabetes disease process in this way. And it may lead to remission where you no longer have diabetes, or it may just lead to you feeling an awful lot better, losing weight and having much better control of your life and your blood glucose levels. So how can type 2 diabetes be reversed? I've had people say to me, well, surely you've got to go, it's this big thing now, you've got to go on a very low calorie diet for 8 weeks or 12 weeks, and that puts you into remission. And I've had someone else who runs a clinic which promotes a ketogenic diet. Well, do your patients lose weight? Because I don't necessarily advocate a ketogenic diet. But let me just go through these quickly. And these are personal observations, so please don't get offended, anyone, if I say something which doesn't quite, isn't your worldview. But I've been allowed to speak, so I guess I'm allowed to give my personal observations. A low-calorie diet undoubtedly is a very effective short-term intervention. The Newcastle group showed that. It pushes people into remission. The direct study has actually, for some reason, taken that experiment, that almost lab experiment, turned it into an intervention. It's now in the guidelines. If you can put people on a very low-calorie diet, they lose 15 kilograms in weight. They've got a great chance of reversing their diabetes. It's actually very difficult to maintain. At the Diabetes UK conference just a few weeks ago, where they presented this study, there was a participant who did this. He was able to reverse his diabetes, but he wasn't a very good advert. He had to pretty much put his social life on hold. He had to exclude himself from his family while they were eating. He felt cold all the time, and he nearly gave up. I know 2 people who've tried it themselves. Both of them had to give up because they couldn't function in their professions, and they were quite high demanding roles they were in. One fainted twice. So yeah, if people want to do it, and I have patients who say, I want to do it, so well, that's fine. I'll support you as best I can. But I think it's sort of missing the point, because not only is it difficult to maintain, what is absolutely critical is when you come out of it, you don't go back to your previous eating habits. And back in Bournemouth about 15 years ago, we used to run a program of very low calorie diets, not for reversal, because we didn't know that happened, but for people who were very overweight. And they did fantastically. But a year later, they were often back at their baseline weight, and often even higher, so we stopped doing it. So, that's my personal view on that, but I'm happy to support people who want to do that. A ketogenic diet, which takes people down to very low carbohydrate intakes, 20, 30 grams even. I have no problem if people want to do that. But again, I've seen people who've done that, haven't been able to maintain it, haven't changed their dietary intake, and are back at square one. But it can be maintained long term if people are able to do that. I personally wouldn't be able to. I mean, I come from a family of bakers. Both my parents were bakers, my grandparents were bakers. I've grown up with bread as part of my existence for all my life. I eat much less bread than I ever did, but I would really struggle, having to not eat much bread. I'm about to acquire a son-in-law who is a brewer of award-winning beers. I'm going to find it very difficult not to drink beer. But, so I think we have to recognize that, yes, it might work for some people, but not necessarily everyone. So my approach was to actually try and do it well, and I've got another list of foods and diets and things, oh my goodness. But this is a piece of work that we did when I was at IDF, because we wanted to show we wanted to inform healthy eating to help prevent type 2 diabetes. We were about to write it up to be published, then another group published exact same piece of work in The Lancet. It was in 2014. I'm sorry I haven't got the reference, but I'll dig it out. But it sort of shows the things that help protect from type 2 diabetes and that increase the risk. And we can argue about the meat bits and what have you, but the starches and the sugars come out absolutely there. They had the strongest association. And so I thought, well, let's just try and stop people eating those and move on to some of these. Now people might argue about rice and bread being up there, and if someone's already got diabetes, that might not be a good idea. But if you're looking at prevention, if you're eating those things, you're likely to be having a healthier diet. So that's what I based my approach on, and sort of informed what I wrote in the book. And it's sort of what is a low carbohydrate diet, I guess. I never quantify it. I was asked to, so I said less than 100 grams, because I like big round numbers. But I think there's a lot of evidence now that if you can get your carbohydrate intake down to less than 100 grams, and that's what I say to people if they want a number, then they're likely to make a really big difference. The response might be slower than some of the sort of more dramatic approaches, but actually sometimes the response is very dramatic doing this. I saw someone just a few weeks ago whose HbA1c came down from 118 to 50 in 2 months, just by a diet sheet that I provided in the clinic. Well, actually, he did have my book, but he said I didn't like it. So I said, well, either we're looking at lots more medication or try reading the book again. So you don't have to be very, very restrictive. And if you allow people to make their own choices about what's going to work for them, and they own it, then maybe it's going to be more sustainable. One thing that I find really, really helpful is this, what I call paired glucose testing. So checking your blood glucose just before a meal and then 2 hours afterwards, not for every single meal. But there's evidence that such structured testing, as it's called, just a few times a week is effective in supporting behavior change and giving people the information about what they're eating is doing to their blood glucose levels, and then they can modify it and so on until, ideally what you want is for your glucose level not to go up after you've eaten. And then last year I learned all about intermittent fasting from Jason Fung, and since then I'm not a great expert, But people where, they sort of done really well, but then got stuck and want to lose more weight, I've had people on a 16-hour fast or a 24-hour fast a couple of times a week, and some of them do really, really well. Don't ask me how it works. I know it's something about fat burning and increasing insulin sensitivity, but interesting. In the Observer this morning, there's some people in Brazil who are claiming that this is bad for you, intermittent fasting. So that's the diet side, but then physical activity. And as I said yesterday, I'm a bit anxious in some of the comments that come out about physical activity, that you can't lose weight, that you can't outrun a bad diet and all the rest of it. And of course you can't, but actually, and I never use the word exercise, because for someone whose longest walk is from the couch to the fridge, a 30-minute brisk exercise every day is just pie in the sky. Can you just include walking into your daily routine? And then breaking up sedentary periods. Can you, just set your watch, your phone, whatever, to buzz every hour? So if you're sat at a desk all day, at least get up at least once an hour, walk around. It has an amazing effect. In the way I put it is your body will go into sleep mode, and this just stops it going to sleep mode. You burn up more energy, your glucose levels come down. When we were in Bermuda for 6 months, we didn't have a car. So for 6 months, we got around by using public transport, walking. I had a pedal bike, and occasional taxi rides. I actually lost over 2 kilograms in 6 weeks. I didn't need to lose weight. I wasn't overweight. It's a bit frightening that was all my visceral fat that I was harboring. But people do lose a lot of weight by increasing physical activity, in my experience and in my personal experience. So just encouraging people to find ways of building that in. 5 hours in Bermuda comes 6 months. So this came about. I was in the US at a conference, and I was invited. Could I stop in Bermuda on my way back to talk to the Diabetes Association about my book? And so I did. And then a year later, I got the call that I mentioned saying, will I come and work in Bermuda? I said, no, I've done with moving to different parts of the world. But we said, well, okay, it's a nice place, it's sunny, and they only speak one language. So let's give it a try. And we went out there for 6 months. And the remit, a few facts about Bermuda, because I had no idea where Bermuda is. It's not in the Caribbean. It's a long way further up. It's 20 square miles. It's like a very long, thin Isle of Wight. It has 67,000 people. It's one of the highest population densities in the world. It has the highest per capita income worldwide. There are a lot of people who are struggling, who are doing 2 jobs, working 7 days a week, and struggling to pay bills, which include medical bills, because it's an American-style health system, although it's a UK territory. The cost of living is 2 to 3 times that over here. And there is a 13% prevalence of diabetes. Why is that? It is the most diabetogenic environment I have ever come across. There is a very high intake of low-cost sugar-sweetened beverages. This is Bermudian ginger beer. There is 48 grams of sugar in that one can. That's even higher than Coca-Cola. And these figures are incredible. A recent report showed that 50% of the population drink 1 sugary drink a day, 34% drink 2 sugary drinks a day, and 16% drink 3 sugary drinks a day. I mean, that is a diabetes factory, isn't it? So if you're drinking, 120, 130 grams of sugar a day, you're going to get type 2 diabetes. It's got a hot climate, especially in the summer, so people like cold, refreshing drinks. And social drinking of alcohol is a lot less part of the culture than it is here. And one of our education sessions we talk about alcohol. Out of 12 people, no one drank alcohol. I've never experienced that in the UK. But people think it's good to drink sugar. So all of those factors go in there. There are very large portions of low-cost sweet foods. I came across this thing. It's called a coffee roll. I would call it a giant-size Belgian bun, sort of, nice, yummy, sugary with icing on the top. I actually measured it. Its volume is over 1 litre. The dietitian we work with estimates there's over 90 grams of carbohydrate in there, so almost half of that, probably half of that sugar, and it costs £1.40. But bearing in mind cost of living, in terms of purchasing power, that's about 50 to 70 pence. Very, very cheap. However, healthy food is really, really expensive. All the food is imported. Fresh fruit and vegetables are often priced per unit, $1.50 per apple, rather than by weight. And we had a standard basket of healthy food that was developed at IDF. I costed it in Bermuda at £33 compared with £10 in London. So it's genuinely unaffordable for many people to eat healthily. And then if that isn't enough, the staple diet is starch. It's things like rice and peas, it's macaroni and cheese, often on the same plate. High density of motorized vehicles. Everyone goes around on a scooter. So no one has to walk anywhere. You can drive literally door to door. I said we walked or cycled. Often we felt very lonely because we were the only people using our legs to get around. So they tick all these boxes, every single one. And that's why there's a very high rate of type 2 diabetes. So my remit was to go over there and could I turn what's in here into a program to be delivered to help support people in reversing their diabetes. And we had the buy-in from the Bermuda Diabetes Association. We went to the Minister of Health, so said, yes, we're absolutely desperate, let's give this a go. One of the biggest medical insurer agreed to reimburse it 100% to their clients because they're just paying out so many millions for complications. And so we gave it a go. And what I was asked to do was put together a 6-week program. And so once a week, people would come together for a structured program which covered all of the bases. And we covered things like what is diabetes. We covered in the first session how can you reverse it, the evidence for reversal. We said we are here to help you reverse the process, not guaranteeing you'll no longer have diabetes, but that was the remit of it. Talking about carbohydrates, talking about healthy eating, healthy fats, where to find sugar and all the rest, physical activity, staying healthy, and so on and so forth. And so that's what we did, but we also built in follow-up because I've done so many interventions over the years where you do something, people do really well, and 6 months it all looks fantastic, but a year later they're sort of heading back to square one. So I said, I'm not really interested in collecting any data unless we have data for a year. And so that's what we did. And we had people coming back every 2 months for data collection and then the groups to support lifestyle changes. So we've got over 100 people so far that I've got data on. I'm just going to present the data from those who have completed a year for the reason I just said. Although I will say that they do so much better in the first 6 months, and a year doesn't look quite so good. But nevertheless, I'll show it as is, and I'll whiz through it because it's just like you see elsewhere. They lose a lot of weight, just under 6 kilograms, 6.2% reduction. They lose waist circumference, 5 centimeters on average. They reduce their HbA1c on average by 1%, which is, I think, about 11 millimoles. Some staggeringly big reductions. So the person who reduced by 39, he actually reduced it by 50 at 6 months, and it sort of crept up a little bit. 6 are now in the pre-diabetic range on no medication, so they meet at least one of the many definitions of being in remission from their type 2 diabetes. Big reductions in systolic blood pressure. Big reductions in diabetes distress. I use a paid scale on almost everything, problems areas in diabetes. It's very easy to fill in, and it just gives an overview of how much diabetes is impacting people's lives. And I saw some of the highest baseline scores I've ever seen, but some of the biggest reductions, so that was good. Lipids, I've not got here because I haven't seen any change in lipids. I've seen a slight reduction in triglycerides so far, but it's not significant. And I've seen some people whose lipids have gone up, and we know that can happen as well. So I need more data to know whether or not we're going to be able to do that. But what about medication changes? 8 out of the 30 stopped all of their diabetes medications. 11 reduced some of them, so in total nearly 2/3 have reduced, including 2 people who've come off insulin. 5 have reduced their blood pressure medications. I expected all of that. But then there was a bonus, people coming along saying, my feet feel normal again. I've stopped taking my painkillers. My arthritis isn't so bad. A few guys are absolutely delighted they don't need Viagra anymore. People have come off medication for gout and for esophageal reflux. And if you add all of that up, medication is very, very expensive there, like everything else. It's a saving of nearly $1,000 a year per person just on medications. Now, when we went to the insurer right at the beginning, I said, look, you should do this because you will save money within the first year because we will get people off medications. quite in addition and apart from the savings further down the line from less heart attacks and amputations and everything else. Thankfully, they believe me. Thankfully, also, it worked out that way. So that's great too. So wrapping up now, some of the challenges we had. There is a lot of fatalism. Just about every family is affected by diabetes. There is no structured sort of care like we have here. There's no National Health Service. Eye screening is sporadic. People go blind. High rates of dialysis. And so a lot of cynicism. And we had very low uptake initially, but that's now increasing as word's getting round. The high cost of healthy food. We had people who lost their jobs and were dependent on a neighbour bringing meals round for them, and they would have been full of starch. Now, they're not going to say, no, sorry, please go back and cook me something that's vegetables. It's a place where it is too expensive for some people. And the high sugar and starch environment. Guess what the traditional Bermudan Christmas dinner is? It's there, macaroni and cheese and cassava pie. Now, I keep hearing about cassava pie. I actually looked it up the other day, and it's got cassava, sugar and chicken in it. It sounds disgusting, but apparently they really like it. But so if you want to stick on a low carb diet, at least here you can enjoy a Christmas dinner and maybe allow yourself 1 or 2 tiny potatoes, but have all the veg and the meat. There, you'd have to exclude yourself, like the guy going on the very low calorie diet if you wanted to stick to it. So it is a real challenge. So what we need to do, of course, is to change the environment. Now, this may or may not be related, but earlier this year, the government there announced a tax on sugar-sweetened beverages and a reduction on taxes on fruit and vegetables. Can you believe they tax fruit and vegetables? We can take a bit more direct influence here because we had discussions with some of the senior hospital management. They withdrew sugar-sweetened beverages from their canteen. And And in fact, when I was there just last time, they've actually come to us and they're wanting to see how we can influence the hospital food that's being served as well. So if Asim had the first hospital, maybe we'll have the second one that will begin to serve healthy food. And when they first withdrew the sugar-sweetened beverages from the canteen, they just took away the 5 most sugary ones and they got kickback. But it quietened down. So then they said, right, we're going to take them all out. So I went down just a few weeks ago. These are, all these banks of drinks machines in the hospital staff canteen, none of them has sugar. Lots of water, okay, it's Coca-Cola brand, and there'll be sweeteners in there and all the rest of it. But, that is a great start. However, there is still work to be done, because if you go downstairs to the privately owned canteen that anyone can go to, you can still buy the sugar-sweetened beverages, and you can buy a sandwich. And if you look there carefully, you can see for an extra $1.25, you can have your crab salad sandwich made in a coffee roll, made in 90 grams of starch. I mean, to us, it's disgusting. But, this is the diabetogenic environment that's out there. This has become normalized. So, to summarize, undoubtedly type 2 diabetes results from modern day lifestyles. If we can get people to change their lifestyles, even in the most diabetogenic environments, we can help people reverse type 2 diabetes, but we've got to change those environments. And I have to finish with just this slide, because when I was at IDF, I learned I just got a real heart for Africa, which is ignored in so many ways. At the moment, Africa has one of the lowest prevalence rates of diabetes, but it's forecast to have the biggest increase. We have a huge opportunity, if we can do something to change it there, to stop them joining the rest of us. But I suspect we're too late. I have a colleague who comes from Kenya. He sent me this picture from a supermarket. Coca-Cola are advertising 4 litres of soda for £2. And now in Kenya, that's probably a lot of money, but there are a lot of people now who are quite rich and could afford that, and they're the ones who are going to get type 2 diabetes. So on that note, thank you very much for your attention.